Welcome to Art Therapy and the Power of Creativity and Healing. My name is Amanda, and I am an art therapist and a licensed mental health counselor. Oops. So just a few reminders. This is, a time that we're going to kind of actually engage a little bit in the presentation. So I'll have you doing an art prompt. You can do it if you'd like. You don't have to, but it would be fun to engage. You can get a little bit of a taste of what a client's experience might be like. And then if you could free yourself from any outside distractions, silence your cell phone. And at the end, of course, there will be a Q&A and satisfaction survey. We'd just love to hear what your thoughts are on how today's webinar was. Okay, so I am actually based in Florida. I am licensed in Florida as a mental health counselor and registered as an art therapist with the Art Therapy Credentials Board. And a little bit about my background. I studied at Eastern Florida State for my associates. Oh, I see the polls here. Great. I'll look at that in a minute. I received my bachelor's degree in psychology at the University of Central Florida, and then I went to George Washington University in DC, where I got my master's in art therapy with a focus on trauma-informed care. I've also worked in the child welfare system with the Department of Children and Families in Florida. I've done primary therapy for acute psychiatric settings, and I also have worked in residential settings for eating disorder treatment, substance abuse, and then currently I do work with Selah Freedom, which is a local nonprofit, faith-based nonprofit that helps to rehabilitate survivors of sex trafficking and human trafficking. And in addition to all that, I have a private practice, a full-time private practice, and I teach. I'm a professor adjunct at the University of Tampa, where I teach intro to art therapy to bachelor level students. So kind of busy. So I'm actually, I think it's so cool that I'm here though, because I love to always spread the word about what art therapy is and educate the public at large. So my private practice, I provide services, art psychotherapy, individual family counseling, group art therapy, wellness retreats, and also workshops in the community. So some of the things we're going to discuss today is the importance of expression. What is art therapy? I have a video, but I don't know that I'll be able to show it because I had some issues with my computer. So we might have to skip that, but I'll give you the resource to watch it on your own. What are the education and training requirements to become an art therapist? The differences between art education, art coaching, and art therapy. And then we'll review some case studies, talk about your local and state laws. Actually, that's supposed to say national and state laws. So we'll talk about that and as it pertains to licensure, and then how to find an art therapist near you. And at the end, of course, is the Q&A. Oops. All right, so why is it important to express ourselves? And you see here is an image of a mask, and it says on the outside, I'm fine. And of course, in the therapy world, fine really kind of means feelings inside, not expressed. And so this is kind of a prompt that we give to clients. It's called the inside outside mask prompt. And it's where they kind of put on the outside what they show to the world. And then on the inside of the mask, they have a chance to design what feelings and emotions and thoughts they kind of keep hidden. And so why is it important to express ourselves? It's, because if we don't, then trouble can arise. We can start to feel sick. And in fact, famous researcher Brene Brown, who works at the University of Texas, and I believe she also is a professor at University of, I don't remember, Austin, Texas. Anyway, she's a famous researcher on shame and vulnerability. And in her work, she concluded also regarding creativity that unused creativity is not benign. It metastasizes, it turns into grief, rage, judgment, sorrow, and shame. And so it's so important for everybody to be able to have a safe space to create and express, because without that, we can start to feel so many different types of tensions and emotions and sickness in the body. Okay, so just as a show of hands, well, I guess I can't see you, but basically, a lot of times when the word art therapy comes up, people associate that term with, or they may associate the term with adult coloring books, where, it's kind of been publicized that adult coloring books are therapeutic. And so here we have a picture of a woman, she's in nature. She's doing an adult coloring book. And my question to you is, and I want you to put it in the chat, is this art therapy? And so I just want to see if you think this is art therapy. I want to see, just put in the chat yes. And if you don't think it's art therapy, put in the chat no. Just want to see kind of what you guys think. Okay, we have a yes, we have an it could be. We have a no. Okay, so the thing is that art therapy requires a therapeutic relationship. It requires facilitation with professionally trained therapists. And so this would be considered a therapeutic arts practice for self-care. And it's really important to distinguish the two, because therapeutic, just doing art for your own self-care is not art therapy. It's a therapeutic practice, but it's not art therapy. Art therapy goes deeper within a therapeutic alliance, where the therapist kind of guides you through processing your thoughts, feelings, and emotions. Okay, here I have another example. Let's get a poll going. Well, not a poll, but just put in the chat. Do you think this is art therapy? This is a painting with a twist, kind of socialization here with a group of friends, it looks like. So let's see. What do you guys think? We have no, no, no. Okay, great. Absolutely. This is not art therapy, because this, first of all, you don't drink alcohol in therapy sessions. So yeah, so this is not art therapy, because this is a social setting that is not in a safe space where confidential information can be shared. This is out in public as an activity to have fun. Okay. Okay, so what I want to do is kind of invite you to do this prompt with me, and we're going to do a loose scribble. So I have my two markers here. You can use a pen and a pencil, or a different colored pencils, whatever you have, but they just need to be two separate things. And you're going to put one color in your non-dominant hand, using your non-dominant hand. So my non-dominant hand is my left hand. And you can either have your eyes open or your eyes closed. And what we're going to do is go ahead and just make that loose scribble, and try to fill up the page as much as you can, but don't make it too hairy. I'm doing it with you. All right. Okay. So mine looks, hopefully I can show you. Well, you can't see it. Anyway, now what I want you to do, after you have your scribble, you're going to take your second color, and we are going to look for a person, place, thing, or object within the scribble. And actually, I'm just going to stop the share real quick. Okay, so person, place, thing, or object. And once you find that person, place, thing, or object, I want you to trace the outline of that object with your other color or pencil. And it might take a minute to find it. Let's see. It's usually the first thing you see. Okay, I got mine. Which, if you need to, okay, add any, okay. So this is mine. Ooh. Sorry, I have my blur on. Okay. I'll reinforce that. And it doesn't have to look like anything to anybody. It can just look like whatever to you. Now, what I want you to do is name that object. So you can just, using the extra space on your paper, name the object that you identified. So I identified myself on the couch with my dog. So this is me and my dog on the couch. Okay. So I want you to think about, what does this object that you found symbolize to you? I feel like, okay, yeah, you guys are still there. I just can't see anybody or anything. So what does this symbolize to you? And just write down a few words. Could symbolize, childhood memories, could symbolize love, could symbolize sadness and grief, whatever it is that you're feeling. All right. So I'll just share what I wrote personally. I put that the object that I identified was an image of myself with my dog sitting on the couch. And to me, it symbolized being tired, stagnation. And then the last question is, how does this relate now to your current life circumstances? And for me personally, this relates because I've been doing a lot of work lately, grading papers, sitting on the couch, and that's how I've been feeling. And so it's really astonishing to kind of have a practice like this where we can kind of pull out some of those things with our clients that is in the unconscious that they don't necessarily know that might be lying dormant under the surface for them. So I'm going to go back to sharing my screen so you can, we'll talk a little bit more about this. And if you feel comfortable to add in the chat what your object was or what it symbolized to you, please do so now. So just a little bit more about this technique. It was developed by founding art therapist Florence Kane in the 1950s. And she was heavily influenced by psychoanalytical theory, so the teachings of Sigmund Freud and Carl Jung, which heavily influenced the field itself of art therapy. Art therapy's been around for over 50 years. Taps into the unconscious to reveal underlying thoughts, feelings, or stressors, and it's still widely used today by art therapists. So if we were in person doing this webinar, you guys would have done an even deeper segment to this, but in dyads or pairs, that would have been really cool. So if you ever have an opportunity to try out an art therapy workshop in person, highly recommend it. So let's go into the actual definition of art therapy. So we have two people. I drew a bird. I drew a surprise face. Okay, that's awesome. Thank you too for sharing that. What are the benefits of art therapy? What's the impact and the importance? So, the American Art Therapy Association defines art therapy as an integrative mental health and human services profession that enriches the lives of individuals, families, and communities through active art making, creative process, applied psychological theory, and the human experience within a psychotherapeutic relationship. This is an incredibly condensed version of their definition, actually. It is equivalent to any option for mental and behavioral health. It integrates creative and visual art media expression, and it also supports the kinesthetic, sensory, perceptual, and symbolic communication between people. What are some of the education requirements and formal training? So you do require a master's degree to get your to practice art therapy. I'm sorry. And then we are trained in theoretical, different theoretical orientations, developmental psychology, grief and trauma. And then, of course, we are also trained to diagnose using the DSM-5. All of our required courses have a psychopathology course. And then cultural diversity competencies as it relates and pertains to art media specifically. And this one's really important too, why you should have an art therapist on staff, because they would have the cultural competencies in the media in their training. And of course, group and individual counseling, assessment, and research. So once we've graduated with our master's, we are required to have at least, well, during the program, we get our internship hours, 1,000 hours at most. And then post-training, depending on the state that you live in, you're required to have 1,200 to 2,000 postgraduate hours of direct contact, and then weekly supervision from a board certified art therapist. So in some ways, our registration and board certification demands even more extensive postgraduate training than some license like LMHC and LPC, which is equivalent to our field. And then, of course, the board certification is optional. You don't have to be board certified unless you live in certain states. After that, after you get board certification, you're required to do 100 hours credits of continuing education every 5 years. So I would like to invite you to go to the American Art Therapy Association's YouTube channel, and they have a whole series of different 5-minute segment videos about art therapy with different populations across the board. And this was going to be a quick video. It was just a 1-minute video of the leaders in the field about art therapy with their specific population. But we'll go ahead and skip that, and I'll let you look that up on your own time. Okay, so why art therapy as opposed to just art class or creative coaching? So let's look at the differences here. Some of the most important ones is, of course, the training is the difference. So, and in art therapy, it involves a therapeutic relationship versus in class, it's a student-teacher relationship. Art therapy should take place in a confidential space. And then, teaching, it takes place in a classroom or studio. In art therapy, the main goal is self-expression, whereas in art education, it's to learn how to make something using specific rules like the elements of art or the principles of design. So you're producing work with the understanding that it will be graded and critiqued, which is not what we do in art therapy at all. Okay. And then, of course, in art therapy, we use tools for self-expression, but in class, art tools are used in specific ways to accomplish a task or a lesson. So again, there's those rules. Students have to be confined to the rules. That's not what we do with clients. We allow clients to use pencil as a paintbrush if they want to. We kind of break through those barriers of limitations. So that leads me to 6. There's no right or wrong way to use the art materials. And then, of course, in class, there might be techniques that they need to do for the quote unquote right way to get a certain grade. Again, we focus on the creative process in art therapy, whereas in art education, it's all about that final product. It's about how does it look? And this is where you'll start to see people become perfectionist with their art or creative process, and they start to kind of taper off their creativity because sometimes it can be a lot of pressure. But again, that's the purpose of art education, is to develop a skill. All right, so, and then the last one, and art is seen as a reflection or extension of the creator, and it's used for communication in the art therapy room. Okay, so what is the difference between the art therapist and the creative coach? So again, the difference is art therapist has a master's degree. They've already received professional credentialing, and they have supervision hours complete. They use psychotherapy and theoretical models with the art media to address mental health. They also have an art background. All art therapists have art backgrounds because the prerequisites in grad school is to have a few, I think you have to have like 12 credits of studio hours, because you have to have a general understanding of the art material. Must be trained in the field to use the title. There is title protection. Teaches tools for emotional regulation to process art, and is also equipped to deal with emotional traumas, mental illness, and suicidal ideation. But for creative coaching, it's mostly about that person's life experience that brings them into wanting to be a creative coach. Their story is their message. It benefits those who they identify as their need. That's kind of, sorry. I was trying to say, like for instance, if they're a painter, they usually stay with painting. If they're a sculptor and do clay, they usually do that. They stay with that, and they don't actually know how to use art therapy, different art therapy media as interventions for emotional regulation. So they kind of stick to the niche that they know. Therapeutic artist identify usually as a life coach, healer, or guide, or art facilitator, have an art background, and they do art making for self-care and stress relief. So famous artist Georgia O'Keeffe said, "I found I could say things with color and shape I couldn't say any other way." And this is true for a lot of our clients. They do have a hard time, especially if they've experienced trauma. They have a hard time articulating what that experience was, because naturally the verbal processes in the brain shut down during trauma. And so there's repressed memory. So it is hard. But when we can do art, we can bypass that verbal barrier, and we can just use pen to paper or marker to paper to really get out what's stuck inside. So the Journal of the American Art Therapy Association, published in 2016, did a study about creativity for people that have never really done or identified as being artistic. And they found that less than 1 hour of creative activity can reduce your stress and have a positive effect on your mental health, regardless if you're artistic or not. And so it's really for everybody. You don't have to have any artistic skill. And that's probably the number one thing that I hear in my practice, or people inquiring about art therapy, is, "Oh, well, I'm not an artist," or, "Oh, I'm not good at art." And actually, it's the clients that have no experience in art that makes it the best client, because then they're not already predisposed or inclined to stick to those art rules that we talked about a second ago. So you don't have to have artistic skill to do art therapy. Okay, so let's jump into our case studies here. So currently, this is a client that I have at Sail of Freedom. She is a white female in her mid-30s. I do not know her formal diagnosis at this time. However, She has a history of trauma, sex trafficking, and addiction, and her ongoing symptoms include overstimulation, severe anxiety, codependency, difficulty with peer socialization, and flashbacks. And so I do art therapy groups with Selah Freedom every other week. And for one of the weeks, we did a guided visual meditation on a safe space, followed by response art. And this is a picture of her response art. And so in the image, you can see these are her legs down at the bottom, and she's kind of viewing herself looking down at her feet while we were doing the meditation, because of course I allow them to keep their eyes open if it's too difficult to close their eyes. And so she stared at her feet during the visual meditation. So this is what she said about her work. This piece portrays my safe space when I'm triggered. It is a grounding technique I use by looking down at my feet and imagining a godlight beam shining down from the sky through my head to my feet. This helps me to know I am safe and staying here. Oh, so sorry. And now knowing God has carried me safely to this moment for his purpose. Sorry about the typos. So this client, of course, struggles with, being in touch with her body. And she described the experience to me afterwards. A lot of times she dissociates during any type of meditation. And, because she has trauma history. But by her being able to use the art process and kind of think back and reflect on how she can overcome those barriers of not feeling safe in her body, and really getting connected with her higher power, she had a positive kind of experience out of this art therapy prompt. Okay. So the next case study I want to talk about is actually related to my thesis that I did in grad school, which was on bilateral art therapy approach as a protocol for treating complex trauma, and it was a single case study. So basically, the objective was to advance clinical applications in addressing trauma related to disorders, while highlighting benefits of using art therapy as a tool for trauma. And for those of you who may not be familiar with bilateral art therapy, it was derived from EMDR, which is eye movement desensitization reprocessing therapy. And the whole basis of bilateral art therapy is that we engage a client using both hands, where they have art tools in both hands, so that we're stimulating that left and right hemisphere, right? And we're having them do an experience. In this case, I was having her do a negative cognition versus a positive or opposite cognition. And so it would be drawing both of those cognitions, but then she would use her non-dominant hand to draw, plus her dominant hand to draw, and then switch and switch. And it's like a 9-step process. So basically, these are some of her images here. Let me see if and a little bit about this client. It was in it was in Washington, D.C. at a trauma art therapy clinic at George Washington University. She was 26-year-old female. Her formal diagnosis was PTSD, generalized anxiety disorder. And so her trauma was having exposure to death, dying, and culture shock. She had lived abroad and had witnessed many deaths around her, and just had a complete shock to her system. And it was over a year span that she lived abroad, and she never was able to get used to the culture with the violence and things that she witnessed. So when she came back, she had significant issues like panic attacks, nightmares, anxiety, and social avoidance. And so this client was also doing psychotropic medication in conjunction with art therapy. So I asked her to identify a negative cognition and a positive one. Well, first it led with the negative one because she was constantly stuck in this negative narrative in her mind, this, personal narrative. So her cognition was, I am broken, I am a broken person. So this is what she drew for I am a broken person. And then over here, I am a whole person. So this is what she was striving for. So I worked with this client over a semester, and we did the bilateral art therapy protocol every session. And so at the end, I was able to collect that data because we had collected, we did a pre and post test on her belief scale of both negative and positive cognition. So at the end of the semester, the outcomes or findings were she had an increase of self-awareness on those negative cognitions. It had become such a habit to her, she wasn't even aware that she was negative all the time. She had higher levels of positive self-regard as a result of that increased awareness and practicing positive cognition development. And then she had a short-term decrease of PTSD symptomology. And so the only reason I'm putting short-term here is because I was unable to collect data in a long-term since I was, only in grad school for 2 years. If I had the opportunity to continue collecting data with her, then we might have had a different result. We might have known the longevity of that. And then she was more able to articulate her thoughts, feelings, and emotions. Okay, so let's talk a little bit about art therapy installation. So here's an example of when I worked at the Renfrew Center for Eating Disorders, and there was approximately 50, maybe a little bit less, residents at this facility. And of course, the primary issue or concern was eating disorder rehabilitation. And so what we did was created these silk hoops, and I had these hoops installed in the one place in the center that provoked the most regressive behaviors or emotional dysregulation, which was the cafeteria. Because of the eating disorders, they would become triggered, and all of their issues would start to come out. So this was a large scale installation to help calm them, soothe them, and provide an opportunity for them to connect with their peers through recovery. And here's some more pictures of this art therapy installation here. Okay, so art therapy for residential treatment. Let's talk about it. So we talked a lot about what art therapy is, what's the difference between education, creative coaching, and art therapy itself. So maybe perhaps you want to add this to your residential program. So things we need to know is what are the local and state laws regarding licensure? What are the code of ethics? Am I practicing or providing this ethically to my clients? And is there a continuity of care? And then, of course, we want to do no harm to the clients. So on the American Art Therapy Association's website, they have a link for national and state advocacy efforts on licensure. So currently, there are 15 states in the United States, and that's on another map I'm going to show you in a second. But there are 15 states in the US that have title protection and licensure for art therapists. Whereas these states that we're looking at here currently have active art therapy legislation that is still in the process of becoming law. And so in Florida, we actually, crossing our fingers, we have our bill HB 51 that is set to be voted on in March. And once that happens, we will have, an art therapy license, which means then the field will be protected, which is so important because there is risk for harm when you hire somebody that does not have the skill set to do, what we do as clinicians. All right, so this is the states that currently do have an art therapy license and or title protection. And then the purple one is that it has licensure under a related license, like I believe, yeah, Texas, New York. Okay, so why is it important to know this? Well, I don't know what states. Actually, if you want to put in the chat which state you're calling in from, that would be really cool to see where everybody's at. But some of the consequences of promoting that you have art therapy at your program when in fact you don't have a registered or credentialed art therapist on site would be like a misdemeanor offense or a hefty fine from the state. And then, of course, you would have to stop all practices immediately or marketing immediately if you don't abide by those laws. Okay, let's see where these people are from. PA, Delaware. Awesome. Okay. Where is Delaware? Isn't it up here somewhere? I don't know. Well, I'm glad to have you here. We have Rhode Island. Maybe I'm looking in the wrong spot. Okay, here we go. So, what are the code of ethics? So, it's not just the laws that we need to be considerate of. We need to know the code of ethics. So, then this is a list per country. So, for the United States, it's the American Art Therapy Association, but we are governed by the Art Therapy Credential Board, and they have our Code of Ethics, Conduct, and Disciplinary Procedures. In the UK, it's the BAAT or BAT. Canada is CATA. And then we have Australia, New Zealand, and Asia, and CATA. And then down here is the international one. So you might actually also have an art therapist that is from the International Expressive Art Therapies Association, which is down here, and their credential is REIT. And so they have Code of Ethics here. So some of our ethical principles for art therapists in the US includes autonomy, non-maleficence, beneficence, fidelity, justice, and creativity. And so I just want to check the time here. 3:41. Yeah, just really quickly, as art therapists, we respect the client's right to make their own choices regarding life direction, treatment goals, and options, as well as their creative process. Non-maleficence is that we strive to conduct ourselves and our practice in a way to cause no harm to individuals, families, groups, and communities. And then beneficence, we have a responsibility first and foremost to our clients and enhance their welfare by identifying practices that actively benefit others. Fidelity, we maintain honesty in our dealings, accuracy in our relationships, faithfulness in our promises, truthfulness in our work. And justice, of course, we are committed to treating all persons with fairness. Art therapists ensure clients have equal access to services. And finally, creativity. Art therapists cultivate imagination for furthering understanding of self, others, and the world. Now, regarding art media materials with the ethics, we have so many things in our code of ethics that's really important to consider as well regarding residential treatment, and regarding storage of client artwork, which we consider as a clinical document. We believe that the artwork is an extension of the artist and therefore may reflect psychopathology in the work and also reflect or have identifying information of the client and should be treated with delicate, in a delicate nature. And so we do require the storage any space in a residential facility needs to have storage for art, for client artwork, and it should be held for at least up to 7 years. So that's really important to know. And the other thing that we don't do is photograph artwork without consent form. We don't display artwork without consent forms. And so all of the art that you see here in the presentation today, I had consent forms for my clients that gave me permission to show this work. And so when we talk about community, a lot of times like at residential facilities or, outpatient, inpatient services, people kind of assume, oh, well, we can just do a community project and display it. And that's really not the case. It has to be very intentional in how we approach those sorts of things. So for instance, the silk hoop installation project that I did at that residential treatment center was months in the planning. It took hours of coordinating with the treatment team. It was really geared, specifically focused on the treatment and care of the patient, which is what we try to aim all of our art therapy interventions on. It's not just to have fun. And so those are some things to really keep in mind. And then another thing is that I think is so very important. We're trained as art therapists to understand what type of material is going to elicit a specific response in a client. And because of that, we're kind of prompting the client or guiding the client in a specific way, right? So if we have a fluid material like paint, that's going to promote regression, right? So if we have a client that is closed off, not able to open up, not able to connect or express their thoughts or feelings, we might give them a fluid material to promote regression so that they would become more open with us. On the opposite side, for restrictive media or materials, for clients that really, really, really need that sense of control, or they're feeling incredibly insecure and unsure about themselves, we might give them a pencil or a pen, because we know that that's going to help boost their confidence and give them a more sense of control. And so what's really important is that when clinicians or people, like creative coaches are working with clients, that they understand exactly what they're doing, as far as eliciting certain types of responses. And if you're not careful, you might end up throwing a client into a dysregulated state. Like if you have a client that suffers from dissociative identity disorder or suffers from schizophrenia, you would, or, clients that have past sexual trauma, we're not going to give those clients certain materials that's going to throw them further into a psychotic break or dysregulated state. So I've had experiences where I've seen non-trained clinicians that are not art therapists, but they were trained as LMHCs, LPCs, but they have no art therapy experience, that triggered clients because they assume they can just come in and do any art with any client and not really realize what negative effect that might cause on the client. So it's really important to have the proper training or clinician in place. Okay, so how do you find a registered art therapist near you? So we have two websites here, very helpful. The American Art Therapy Association, their website is arttherapy.org. And then we have the Art Therapy Credentials Board, the ATCB. You can go on both of those sites and they'll have a list for you. But specifically on the American Art Therapy Association's website, they have an art therapist locator. And that's for the whole United States right here. So you can just go on their website, look at the state, but I will say this doesn't list all the art therapists. I think currently right now there's over 5,000 registered art therapists in the United States. This really kind of only lists the ones that are in private practice, because otherwise the art therapists that are already working at hospitals or working at schools, there's no reason for them to be on the locator map because they already have employment. They're not looking for clients. So most of these are private practice. Okay, so we have, I believe, about 10 minutes. What time is it? Yeah. For questions and answers, and then there's a short satisfaction survey. So if there's any questions, you guys can go ahead and put it in the chat.
I think there was one question that came through, Amanda, about Pennsylvania.
Okay, so for Pennsylvania, does this mean that we aren't allowed to use art therapy in our program? I'm not sure. I'm not sure. Do you currently have an art therapist working for you? This would be to Kimberly. And
I'm gonna allow you to talk too, Kimberly, if you'd like to unmute yourself too.
And I'll just go back to this map real quick. Hold on. I'm trying to get this poll off of here. Oh, there we go. Okay. PA currently has licensure under a related license. Okay. Kimberly, are you there? So basically what I'll say is if you don't currently have an art therapist on staff, I would highly caution you to say that you are doing or providing art therapy at your facility, because you could run up against fines and or legal charges for promoting that you're providing something when you don't have a clinically trained art therapist on staff to actually provide that.
This was super helpful. Thank you so much, Amanda. I've gained so much insight myself, and I think the different modalities, or I guess you would call it, different ways of doing art, right? Different, if you're doing painting versus drawing, and what that means for mental health and things like that. So that was super insightful, and we're definitely excited to have you here with us. So for everyone who doesn't know, this will be available in the Knowledge Center. So this recording will be there. Amanda's contact information. Do you have that on the slide too, just in case?
Let's see.
If she doesn't, feel free to reach out to me, and I'm happy to connect you. I'm the one who sent the link. My name is Anna. So I am happy to connect you if you have more questions, and we're super excited to have you here. So thank you for coming, and please put any questions in the chat. We'll hang on for just a second, but that's it. Yeah.
Yeah, and I can just add a little bit more about the art materials. Being culturally competent with art materials is huge too, which includes even when you're doing collage, you've got to have a diversity of what the magazines are. You can't just have one specific type of magazine that caters to only one type of culture. And then again, with markers and stuff, multicultural color markers, like it was so awesome that Crayola came out with the skin tone markers, which is exactly what we were, needing. So, and now that's kind of almost a requirement in the art therapy studios, is to have skin tone colors and markers, because it should be open and all inclusive.
Love that. Yeah, that's something that we're constantly trying to encourage in this field, is cultural competency. So I love that it's already incorporated in art therapy. So
Yeah.
perfect. Yeah, if anyone has any more questions, feel free to reach out to me. Membership@shelteredalliance.org is the general email. So feel free to reach out, and I'll connect you with Amanda. But thank you, Amanda. This is
Yeah.
great.
Thank you. And if anybody has questions for me, you can visit my website or you can email me. My email is createflowheal@gmail.com. All right, I'll see you later.
Everyone.